Hi everyone, this is Priya and today I'm here to discuss one of the NCLEX question which can really help you to pass your real exam. I will be teaching you here how to analyze a question, how to use your critical thinking and applications in picking the right option. So let's begin with the question. We have one question here which is, what are the signs of IV infiltration? So when you're looking into the scenario, you can see the keyword sign and infiltration. So that's your keyword for the exam. So here the options are option A, cold to touch, edema and pain. Option B, warm to touch, edema and pain. Option C, cold to touch, swelling and bleeding at the site. And option 4, decrease the rate of drop factor. So when you're doing a question like this, it looks very small, it looks very short, and then you think, oh, you know the answer. But you have to use your critical thinking and application when you're analyzing a question like that. Sometimes you know everything and still you make mistake. So here, the key word is sign of infiltration. So we have to know what is infiltration. So when the nurse is initiating an IV line, instead of going into the vein, it's staying into the interstitial tissue. And what you can see there is the fluid is collecting inside the skin. So you will be seeing edema, you will be seeing pain, you will be seeing cold to touch, which is the cardinal sign of infiltration. So let's see if you have that option here. So yes, we do have here cold to touch, edema and pain. Of course, that's the best answer. Let's see if anything is there which can be a second answer. Warm to touch, edema and pain. This is the sign of phlebitis. So we have to eliminate this option because they're not talking about phlebitis, they're asking about infiltration. So we have to eliminate that option. We have C option here, which is cold to touch, swelling and bleeding at the site. So of course this is right, this is right. This is a possibility. There is a possibility sometimes bleeding can happen, but mostly the most important thing you will be seeing there is cold to touch, pain and edema. So we have a very best answer. This could be your second answer, but when we have best, we don't need to go for second answer until it's a SATA question. Fourth option, decrease the rate of drop factor. This can be also an answer. If it's a select that apply, we can pick that as an option as well. Because when somebody has infiltration, it's going to affect the drop factor as well. It can decrease. But this is not the best answer because this is a multiple choice questionnaire and we have to pick only one answer. So here, the best answer for this question will be option A, cold to touch, edema and pain. This is the way you have to analyze your question. I'm going to bring another question on another day, and always remember that when you are doing your real exam, you need to have a good knowledge, you should have a good application, you should have a good critical thinking. So if you practice more, it's going to help to improve all this area to pass your exam. That's all for today.